Methicillin-resistant Staphylococcus aureus, otherwise known as MRSA. The history of antibiotic resistance in Staphylococcus aureus spans more than half a century. MRSA is caused by a strand of staph disease. There are two strands of MRSA, HA-MRSA and CA-MRSA. MRSA can be contracted from hospitals or other healthcare settings, like nursing homes and dialysis center. When it occurs in these types of places, it's known as healthcare-associated MRSA, HA-MRSA. HA-MRSA infections are usually due to invasive procedures or devices. These include surgeries, intravenous tubing, or artificial joints. There is another type of MRSA called community-associated MRSA, CA-MRSA. This type is more common in healthy people. It often begins as skin boils. It is spread by skin-to-skin contact, droplet transmission. Those who are high at risk are high school wrestlers or other contact sports, poor hygiene, child care workers, and people who live in crowded conditions. MRSA itself is the etiological agent that causes Staphylococcus aureus. MRSA usually starts out as a small red bump that resembles pimples, boils, or spider bites. These can quickly turn into deep, painful abscesses that require surgical draining. The bacteria can remain confined to the skin. The affected area would look swollen, red, painful, pus-filled, and warm at the site. They can also burrow deep into the body, causing potential life-threatening infections in bones, joints, surgical wounds, the bloodstream, or heart, valves, and lungs. MRSA strands are particularly serious and potentially fatal pathogens that possess virulence mechanisms including toxins, adhesions, enzymes, and immunomodulators. There are no vaccines for MRSA, but there are other ways of prevention. An interesting preventative for MRSA is copper and copper alloys. They proactively defend against MRSA. Copper is an excellent material for frequently touched surfaces because it has the ability to kill MRSA fast and efficiently. It also does not allow for the buildup of MRSA deposits. Hospital workers would like to build a hospital with bacteria-killing materials such as copper. This would reduce the amount of disease caused by droplet transmission. Simple preventions like washing hands and covering cuts or scratches with a clean Band-Aid can be very effective to protect against CA-MRSA. Covering cuts can prevent any bacteria to get into the wound. If the pus is in the cut contains MRSA, then keeping the cut covered will prevent it from spreading. Along with washing your hands and covering cuts, making sure not to touch anyone else's Band-Aid or cut is very important as well. Keep personal items to yourself, like not sharing towels, athletic equipment, or razors. Showering right after an athletic event using soap is another important way to stay safe from MRSA. Prevention for HA-MRSA would be to be sure that when caring for people in isolation to wear protective garments and to follow strict hand hygiene procedures. Contaminated surfaces and laundry items should be properly disinfected. MRSA is resistant to certain antibiotics called beta-lactams. These types of antibiotics include penicillin, methicillin, oxacillin, and anoxacillin, as well as many others. Treatment for MRSA for both healthcare-associated and community-associated strands of MRSA can still respond to certain antibiotics. These antibiotics are Bactrim and vancomycin, which are often the first drug used. Other options are clindamycin, minomycin, and cinarcid. In some cases, antibiotics may not be necessary. For instance, many doctors may drain a superficial abscess caused by MRSA rather than treat the infection with the drugs. And be sure to never try to pop or drain it by yourself. MRSA can be carried in your nose. Approximately 25 to 30% of us have staph bacteria in our noses. Severe cases of MRSA can result in MRSA spreading into the blood and causing sepsis. It is a life-threatening blood infection that progresses very quickly and is often fatal. MRSA can also cause cellulitis, an infection of the deeper layers of the skin and the tissues beneath. On the surface, the skin looks pink or red, like sunburn, and is usually warm, tender, and swollen. Cellulitis may spread quickly over a few hours. Staph infections are known to cause pneumonia. In rare cases, a MRSA infection can be serious or fatal. In very rare cases, staph can result in necrotizing fasciitis, or flesh-eating bacterial infections. These are serious skin infections that spread very quickly. MRSA is a very harsh disease, and although there are treatments, it should be taken serious and seen by a doctor right away.
Hey there, with your hands in the sink, I said, hey there, have you started to think about C. diff and the MRSA? 'Cause we've got to keep them at bay. People at the UHSM, I said, people, now that we've got a plan, we can get clean, but we gotta improve making bacteria yesterday's news. We gotta wipe out the MRSA. We gotta wipe out the MRSA. We have everything to put this bug in its place, so together let's win the race. We gotta wipe out the MRSA. We gotta wipe out the MRSA. You can get your hands clean using plenty of soap. It will save lives of other folk. C. diff, what you talking about? I said C. diff. It can't be bad without doubt. It's bacteria that's affecting our lives. We gotta keep it at bay to survive. That's why we gotta work as a team. It's our duty to keep all our hands clean. So keep washing and keep washing them well, using water, soap, and even hand gel. We gotta wipe out the MRSA. We gotta wipe out the MRSA. Hey there, let's keep our hands squeaky clean. No nasty germs, if you know what I mean. MRSA, we gotta wipe out the MRSA. Hey there, are you listening to me? Hey there, we gotta work as a team. MRSA, we gotta wipe out the MRSA. Hey there, let's keep our hands squeaky clean. No nasty germs, if you know what